Oh, the dreaded sprained ankle. We've all been there. If you haven't been there, they really suck. I'm Dr. Brett Fifely with BackFit Health and Spine, Goodyear location. Today we're going to talk about how you can fix a sprained ankle. So what exactly is a sprained ankle? Well, a sprained ankle is if you get some stretching or tearing of the ligaments of the bones around the ankle. Now this usually happens with excessive twisting or rolling of the ankle, most of the time due to things like sports. So we get a lot of athletes that come here in the office saying playing basketball or volleyball or whatever it is, and their ankle rolls, okay? Not to mention that we do get regular people like myself that do get sprained ankles stepping off a curb or, doing things like wearing high heels, because we all wear high heels. Well, not necessarily me, but we all wear high heels. We roll the ankle, things happen, okay? So a sprained ankle, some of the signs that you see from a sprained ankle. Does it bruise? Does a sprained ankle bruise? Yes, of course it bruises. We get a lot of bruising usually with sprained ankles. The other thing that you usually see right off the bat is inflammation. We see a lot of pain with that as well. People coming in on a sprained ankle can usually hardly walk on that ankle. So one of the first things that we do here at BackFit Health and Spine is we take an x-ray, okay? What is the difference between a sprain, a tear, and a fracture? That is one of the main things that we need to find out first. So a fracture is where the bone actually breaks. Okay, now when we take an x-ray, we're going to be able to see if there's a fracture in there. Of course, a sprain, there will be no fracture. Depending on the severity of the sprain, which we can find out through our different exams and things that we do, we may need to send for an MRI. Okay, MRI is going to show us the exact tissue in there if we have a partial tear or a full tear of that ligament in there, okay? So the next question is, how do we fix a sprained ankle? Well, right off the bat, there's a lot of swelling, a lot of inflammation. It's very, very difficult to get any motion, mobility into there. So first thing we do, classic RICE, rest, ice, compression, elevation, all right? A lot of compression helps reduce that inflammation. The ice, again, reduces the inflammation. Another thing that we can do here at BackFit Health and Spine is we actually do K-tape. So K-tape, kinesio tape, is a method that we use, and it helps to open up those lymphatics and it helps to drain that. Really, really cool stuff. For those of you who don't know what K-tape is, look it up. You put K-tape on a bruise, on a sprain, whatever, you can actually see the lines where the tape was. You can see that healing process. I'm actually going to put a picture right up here of that as well so you guys can see it. Really cool stuff. So ice, compression. Once we get that inflammation down, then we can work into the rehabs. We have to start strengthening up those soft tissues again. Anytime we have an injury, there's soft tissue damage. That tissue is weaker. You're more susceptible to injury. So we really have to get that strengthened up. We have rehab here in the office. A lot of good foot and ankle exercises. We have physical therapists and rehab techs that know how to work that stuff with you. So one of the other things that we look for when we have a sprained ankle is the soft tissues around the ankle. The muscles also can become damaged, okay? So we will work on myofascial release, rolling out those tissues, breaking up trigger points. We can do trigger point injection treatments with that if we need to. We have massage that we can do as well. We really like to get that tissue mobilized again. Once we're getting that tissue mobilized, now we jump into rehab. We have great protocols that we do to strengthen up the ankle. Without that strength, the ankle's weak and you're more susceptible to rolling that again. So how long does it take a sprained ankle to recover? Well, that question is depends on everybody else. We can have anywhere from 2 weeks, anywhere from 6 to 8 weeks. Just depends on the treatments that you do. If you're overusing it, one of the main things that I recommend is to stay off the ankle. You look at professional athletes, they pull a muscle, they roll an ankle, whatever it is, they're out for like 6 to 8 weeks. That's because you have to have that ample time for that tissue to repair. You start playing on that tissue, you start running, you start moving on it, that it's gonna take longer to heal. So biggest thing is just go through the right steps, do the exercises, rehab the ankle. Usually takes about 6 to 8 weeks to fully recover from that. So if you're suffering from a sprained ankle, what do you do about it? Rest, ice, compress, elevate. Get in your car, drive to BackFit Health and Spine. We'll do an evaluation and figure out the best treatment for you. And if you liked the video, if it was helpful, do not forget to subscribe to our channel and hit the thumbs up button.